The function of thyroid hormone, that is T3 and T4, the first and the most important function of the thyroid gland is it maintains the basal metabolic rate. Basal metabolic rate. Basal metabolic rate, that is BMR, it maintains the basal metabolic rate. And what is BMR? The BMR is the amount of energy. The amount of energy body use at rest. Body use at rest to maintain the vital function. Vital function like breathing, heartbeat, brain activity, maintaining the body temperature. Imagine if you lie down all the day doing nothing, not talking, not eating and not moving, your body still need energy to keep our heart beating, help you to breathe, keep our brain active, keep our body warm. All these activities need energy, and the minimum energy your body need to perform these life sustaining function is called the BMR. So the BMR is the amount of energy your body need at rest to maintain the vital function. The thyroid hormone increase the ATP production and consumption, which helps maintain and elevate the BMR. So the thyroid hormone increase ATP production and consumption, which help maintain and elevate the BMR. Thyroid hormone produce the ATP by upregulation of sodium, potassium, ATPase pumps, and by uncouple the oxidative phosphorylation. The thyroid hormone increase the ATP production by upregulation of sodium, potassium, ATPase pump, and by uncouple the oxidative phosphorylation. So let's discuss, suppose we have a cell, and on the cell we have sodium, potassium, ATPase pump present. What the thyroid hormone does, it upregulates this sodium, potassium, ATPase pump. As this pump require ATP, so there is an increased demand of ATP by the upregulation of sodium, potassium, ATPase pump, and increased demand of ATP result in the increased activity of electron transport chain in mitochondria. This is the mitochondria. So increase the ATP demand, which in turn increase the activity of electron transport chain in the mitochondria, so as to produce the increased ATP demand. And for proper functioning of electron transport chain, there must be presence of oxygen. So oxygen consumption is increased. Increased oxygen consumption. By the increased oxygen consumption, there is increased ventilation. With increased activity of electron transport chain, result in increase the production of ATP, and also there is a production of heat as a byproduct of electron transport chain. That's why the patient of hypothyroidism are heat intolerant, and why some people with the hypothyroidism are cold intolerant. Because in hypothyroidism there is decreased T3 and T4 hormone. So decreased thyroid hormone decrease the upregulation of sodium, potassium, ATPase pump, decrease ATP demand, and ultimately decrease the heat production. On the other hand, with the increased T3 and T4 level, in case of hypothyroidism, there is upregulation of sodium, potassium, ATPase pump, and ultimately increase the ATP and increase the production of heat. And that's why the hypothyroid patient are heat intolerant and the hypothyroid patient are cold intolerant. With the increased activity of electron transport chain stimulated by the thyroid hormones, there is increased chances of uncoupling oxidative phosphorylation. What is uncoupling of oxidative phosphorylation mean? Where glucose and fat break down by the process of glycolysis and Krebs cycle, and ultimately the electron from the Krebs cycle flow through the electron transport chain, and by the flow of electron through the complex 1, complex 2, complex 3 and complex 4 of the electron transport chain, there is the production of this proton which is pumped into the inner mitochondrial space, and these protons flow back through an enzyme called ATP synthase and make ATP, and these protons, by passing through the ATP synthase, lead to the formation of ATP and the production of heat. This is the normal coupling process of oxidative phosphorylation. With the increased activity of electron transport chain, these protons, instead of going through the ATP synthase, leak back into the mitochondrial matrix without passing through the ATP synthase. So there is no production of ATP, but energy is produced as heat. And this process is what we called as the uncoupling of oxidative phosphorylation. This means that although electron moves rapidly through the chain, not all that energy is used to produce ATP. Instead, some of it is dissipated as heat. Key mechanism through which the thyroid hormones increase BMR and heat production, and that's how the thyroid hormones produce heat by the upregulation of sodium potassium. ATP is pumped by the uncoupling of oxidative phosphorylation. In case of hypothyroidism, there is cold intolerance because of decrease of heat production. Decrease heat production, so decrease BMR, and there is decreased respiratory rate. Decreased respiratory rate and depth, and there is a risk of hypoventilation, carbon dioxide retention, and sleep apnea. And what happened in the hypothyroidism, there is heat intolerance because of increased production of heat and ATPase, increased BMR, basal metabolic rate. So let us simplify it with an example. What happened during exercise? During exercise, the body produces heat due to increased metabolic activity. So there is increased production of heat during exercise, heat production, and in response, the heart rate, the respiratory rate, the body temperature, and the sweating. And in response, the heart rate, respiratory rate, body temperature, and sweating increase to help regulate body temperature and meet oxygen demand. These changes reflect the increased metabolic activity. Metabolic activity, if increase in heart rate, increase in respiratory rate, increase in sweating, etc., occur while the body is at rest. These activities occur while the body is at rest, and this indicate the increase in BMR. So this means the body is using more energy in resting state, which is commonly seen in condition like hyperthyroidism. So what happened in hyperthyroidism? So what happened in case of hyperthyroidism? There is increased heat production, and which in turn increase the heart rate, respiratory rate, sweating, temperature. These activities indicate there is increase in BMR, that is increase in basal metabolic rate while the body is at rest. That indicate the increase in BMR while the body is at rest, and the opposite is for hypothyroidism. So what happened in hypothyroidism? There is decrease in heat production, and because of decrease of heat production, there is decreased body activities like decreased heart rate, decreased respiratory rate, decreased body temperature, and these activities indicate there is decrease in BMR. So in hypothyroidism, there is decrease in BMR due to decreased body activities at rest. And in hypothyroidism, there is increased BMR because of increased body activities at the resting state. And I hope this clear now. And now the effect of thyroid hormone on the carbohydrate and lipid metabolism. The thyroid hormone, especially the thyroid hormone T3, are the metabolic accelerator. That is, they increase the BMR, which means every cell in the body become more metabolically active, including those handling glucose and fat. So what happened in case of carbohydrate metabolism? In case of carbohydrate metabolism, the thyroid hormone enhances the glucose absorption from the gut. Glucose absorption from the gut. Thyroid hormone increase the process of gluconeogenesis in the liver. Gluconeogenesis in the liver, and also increase the process of glycogenolysis, that is breakdown of glycogen into the glucose. And because of increase of glucose absorption, increase of gluconeogenesis, and increase the process of glycogenolysis, result in increase the blood sugar level. Increase the blood sugar level. So increase the glucose absorption, increase the process of gluconeogenesis, and increase the process of glycogenesis, result in increase the level of blood sugar. Normally these blood sugar level are balanced by the increased cellular uptake, unless there is coexisting the insulin resistance or diabetes. That is why in case of hypothyroidism, they may sometimes present with the glucose intolerance, or there is exacerbation of diabetes because of increase of blood sugar level, especially the postprandially. So because of increase of blood sugar level in case of hypothyroidism, they may need higher dose of insulin or higher dose of oral hypoglycemic drugs. And in case of hypothyroidism, the diabetes control may appear better. The diabetes control may appear better in case of hypothyroidism because of number one, because of decreased glucose absorption from the blood. And also because of decrease the process of gluconeogenesis in liver. And secondly, because of hypothyroidism, because of decrease of thyroid hormone, the insulin metabolism becomes slower. That means there is prolonged action of insulin. So diabetes control in case of hypothyroidism is better because of decrease of glucose absorption from the gut, and because of decrease of process of gluconeogenesis, and also because of decrease of thyroid hormone level in the body, the insulin metabolism becomes slower. So because of these reasons, the diabetes control may be appearing better in case of hypothyroidism. But because of decrease of insulin metabolism, the action of insulin is prolonged. So there is increased risk of hypoglycemia, especially in case of diabetic patients, where they use the long-acting insulin, So the summary is, in case of hypothyroidism, there is increased blood sugar level in the body. It worsens the diabetes. And in case of hypothyroidism, there's decreased blood sugar level in the body. So better control of diabetes, but there is a risk of prolonged hypoglycemia. And now the effect of thyroid hormone on the lipid. The thyroid hormone stimulate the process of lipolysis. There is breakdown of stored fat into the free fatty acid. And also the thyroid hormone increase the cholesterol clearance by upregulating the LDL receptor in the liver, which helps to remove the LDL cholesterol from the blood. That's why in case of hypothyroidism, there is increased risk of hypercholesterolemia and weight gain. In case of hyperthyroidism, there is lower serum cholesterol, fat loss, and ultimately result in weight loss. So these are the effect of thyroid hormone on the carbohydrate and on lipid metabolism. Thyroid hormones are essential for number one, the neural development, and also for myelination, And third, for synapse formation. So thyroid hormones are essential for neural development, myelination, and synapse formation. So in case of adult, it helps to regulate the alertness, mood, and neuromuscular coordination. So in case of adult, the thyroid hormones help to regulate alertness, mood, and neuromuscular coordination. So in case of hypothyroidism, there may be nervousness, irritability, psychosis, fine tremor, and hyperreflexia. And in case of hypothyroidism, there may be depression because of low mood. There are delayed relaxation of deep tendon reflexes. There is lethargy, psychosis, and excessive sleep, that is somnolence. There is excessive sleep, that is somnolence. So thyroid hormones help in alertness, mood, and neuromuscular coordination. In case of infants and children, the thyroid hormone deficiency leads to a condition called cretinism. And what is cretinism? There is severe developmental delay and mental retardation. There may be a stunted growth. So there may be a stunted growth due to the thyroid hormone deficiency. And these are the effects of thyroid hormones on the central nervous system.